Hello, this is Dr. Archana Singh, Senior Consultant, Corneal Refractive Surgery Services, Shekar Eye Hospital. Today, let us look into a very important topic and a very common condition which most of you would face, and that is dry eyes. Are dry eyes a serious condition? Are there any natural remedies for dry eyes? Before answering this question, let us look into the physiology and science behind dry eyes. Dry eyes is a very common condition affecting about 8 to 40% of the general population in various degrees of severity, affecting their day-to-day activities. Dry eyes can happen because of two things. One, because of reduced quantity of the tears. Two, because of poor quality of the tears. Various factors, both internal and external, can affect both quality and quantity of the tear film, giving rise to various symptoms of dry eyes. Good, healthy, natural tears are very important to maintain the health of the ocular surface, to keep your eyes lubricated, to maintain good condition of the ocular surface, to make your eyes more comfortable, and also in turn maintain a good vision. A tear film is a very thin layer, around 7 micron thick, covering the outer surface of the eyes, giving good nutrition and lubrication to the eyes. Tear film contains various layers. There are 3 layers in the natural tears. One is the lipid layer or the oil layer, which is produced by the lipid glands or the meibomian glands. In common language, we also call it as the oil producing glands, which are located in the lid margins. Next is the aqueous film. This is produced by the tear glands, which are located under the lids. Third is the mucin layer. This is produced by the mucin cells or the goblet cells, which are produced by the conjunctiva, which is a thin transparent layer which covers the outer surface of the eyeball. As I told, good, healthy, natural tears are very important, and functioning of all these 3 layers is very important to maintain your eye surface, to keep your eyes healthy, and to reduce the symptoms of dry eye. Age is a very common factor. With aging, dry eyes happen very commonly, especially in females, due to hormonal changes and conditions like menopause, pregnancy. All these conditions can cause dry eyes, or it can increase already existing dry eyes. Next, various systemic conditions like uncontrolled diabetes, thyroid, rheumatoid arthritis, and various autoimmune conditions can also cause or aggravate your dry eyes. Next, coming to certain lid conditions like non-functioning or malfunctioning of your oil glands, what we call as meibominitis or meibomian gland dysfunction, and crusting or blepharitis, crusting or deposits on your eyelashes. This also can cause dry eyes. Various lid anomalies like inability to close the lids properly due to various neurological conditions can cause dry eyes. Inturning or outturning of the lids, called as entropion or ectropion, can also lead to dry eyes. And reduced blink reflex could be due to environmental factors or due to neurological problems. If the blink reflex is reduced, this also can add on to the dry eyes. Next, coming to various medications like cold medications or antihistamines, which people regularly keep taking. So overuse of these medications can increase your dry eye symptoms. Other medications like antacids, which you take for your acidity problem or gastritis, and certain medications like beta blockers, all these can cause dry eyes. Certain eye drops with a lot of preservatives, and if you are using it without your doctor's advice, buying it over the counter medications, these also can add on to your dry eyes. Next, various external or environmental factors like too much exposure to AC environment, very hot and dry weather conditions, exposure to screen time, like including all your gadgets, be it phone, laptop, tabs. Increased screen time can also increase your dry eye conditions. Next, contact lens overuse or abuse is another very important cause for dry eyes. Allergies in the eyes. This also can aggravate your symptoms of dry eyes. Dry eyes can present in various symptoms like redness, watering, irritation, insensitivity to light. Even normal lights will be hurting your eyes. And constant irritation or gritty feeling, foreign body sensation in your eyes. All these are symptoms of dry eyes. In contact lens users, there can be reduced tolerance to contact lens. Your ophthalmologist will conduct a thorough eye examination to diagnose if you have dry eyes, which includes a complete vision test. Next, a thorough slit lamp examination, wherein your doctor will look at any anomalies of the lids, how your oil glands are functioning. They'll also look into the quality of the tears, tear film height, tear film breakup time, and any dry spots on the cornea. All these will be examined by your ophthalmologist. Next, there are special dry eye tests which is done to confirm the severity of dry eyes. To name a few, we do something called as Schirmer's test, wherein we check the amount of the tear film. Next, we do some staining tests, special staining tests to look into the dry spots on your cornea, tear breakup time. This is also one of the staining tests. Your doctor also might advise certain blood investigations to look for any hidden causes leading to dry eyes, like checking your blood sugar, thyroid abnormalities, checking for rheumatoid arthritis and various autoimmune conditions. Because many a times, patient may not know that there is some hidden cause. They usually present to the ophthalmologist with symptoms of dry eyes, and when we investigate, we pick up the root cause for dry eyes. Next, sometimes we also check the matrix metalloproteinase levels in your tears, which could be causing inflammation in your eyes, increasing the symptoms of dry eyes. First, commonly we start off with something called as artificial tears or tear substitutes, which will work in place of your natural tears so that it gives good lubrication and reduces the inflammation in your eyes. Again, the composition of the tear substitutes will be decided by your doctor depending on how severe your dry eyes are. Next, looking into some lifestyle changes like reducing exposure to the screen time. This is very important. We always tell the computer users to follow something called as the 20-20-20 rule, which means every 20 seconds every 20 minutes take a 20-second break and look at some far object like 20 feet away, which will reduce your symptoms of dry eyes. Blinking in between your work is very important. See, the normal blink rate in a human being is around 15 to 20 times per minute. But when we are doing any work with concentration or when you're looking at your screen with concentration, we hardly blink. So the blink rate will be reduced a lot. Blinking is a very common, very important mechanism to produce tears from our tear glands, and also in spreading of the tears, which maintains lubrication to your eyes. As I discussed about tears, it acts as a natural barrier in our eyes, preventing damage from the external factors like external pathogens, irritants, foreign bodies. It gives a natural protection to our eyes and keeps our eyes healthy. Blinking also contributes to the same mechanism. So this is a very important thing which has to be followed. Next, wearing some protective goggles, especially when you are exposed to bright lights or when you are exposed to dusty and windy conditions, wearing good UV protection goggles is also very important. If you live in a dry weather or dry place, using some humidifiers will also help to reduce your symptoms of dry eyes. Maintaining the lid hygiene, like using some lid cleaning scrubs or a baby shampoo to remove the crusts from your lids. Giving hot compresses to the eyes, which will help in better functioning of your tear glands and improving the quality of the oil layer, which protects your eyes and avoids evaporation from your tear film. So these are some home remedies which you can do. Also, certain oral supplements like omega-3 fatty acids. These are also very important in maintaining the meibomian gland functioning and giving better lubrication to the eyes. Omega-3 fatty acids can be consumed either in the form of food supplements or in medication form. Foods like walnuts, chia seeds, flax seeds, soy oil, palm oil, all these are very rich in omega-3. And fish like salmon, this also contains high omega-3 fatty acids. This definitely can be incorporated in your diet. Next, your doctor may also decide on giving some omega-3 supplements in the form of capsules depending on your eye condition and the severity of dry eyes. Even in contact lens users, contact lens overuse or abuse has to be definitely avoided. You have to take care of your eyes when as a contact lens users. Treating allergies is also very important. When there are allergies, there can be various chemicals which can be released in the eye, irritating your eye, increasing the symptoms of dry eyes. So your doctor may prescribe some additional medications to reduce the inflammation, like anti-inflammatory medications along with tear substitutes, sometimes even antibiotics to treat the underlying condition. Definitely yes, patients with dry eyes can also lead a normal life provided they are diagnosed early and treated on time and follow your doctor's advice. This is very important. Once the medications are given, how well you follow the treatment and keep a follow-up with your doctor is very important. Dry eye medications in some people can go on for a longer time depending on how their symptoms will improve. This your doctor will decide only on the follow-up and advise you whether it can be stopped or it has to be continued. Hand in hand, any underlying systemic conditions has to be treated and the eye medications will go on parallelly, which will help you to lead a normal life. So, do consult your ophthalmologist and take appropriate advice if you feel you have symptoms of dry eyes, which will definitely help you to lead a normal life. Thank you.